Now, remember the child with the leukemia, okay? And we get him a bone marrow transplant, everything's honky-dory. But if you can't get a good HLA match, they found out decades ago you could use the stem cells in umbilical cord blood, the adult stem cells, and use those, and the bone marrow gets completely grown back, okay? They're expanded. There's not enough of them in the blood. You got to take them out and expand them from 100 to 10 million, okay? And then put them into the child, and the child will regrow the bone marrow. Well, that's exactly what we did going on about 8 years ago. We said, well, if you can heal the bone marrow that was destroyed with radiation, why can't you heal the brain that was injured from multiple sclerosis, or heal an autistic kid's brain, or heal the spinal cord, or treat other diseases? So we went overseas, and we took umbilical cord blood, and we treated multiple sclerosis, and we're getting about 70% response rate, where the patient is truly elevated to a better a type of life. The functional capacity comes back, and we've gotten a lot of patients off their immunomodulatory drugs, which cost $40,000 a year for the rest of your life to get a 30% response. Okay? Now you can imagine if you owned the immunomodulatory patents, you wouldn't want stem cells to come in here and make the you're losing $40,000 a year for every patient that's being treated for MS, and all patients are getting treated that way in the United States. We did the same thing with rheumatoid arthritis, okay? 100% response rate. Now, when you get this kind of deformity, you can't reverse that. But if we got to treat every patient with rheumatoid arthritis before this deformity happened, they'd never get there, okay? Autism. We had a 9-year-old autistic kid, and we've treated many kids with autism. This one sticks out in my mind because you know, she was one of the first, and we all remember her. This was published, it's on the internet, but she was 9 years old, she couldn't even talk. And I don't know if you know any autistic kids, but they are very difficult for the family. The other kids, their attention is lost from them because this kid needs so much attention. And just an injection, IV, intravenous, of adult stem cells taken from umbilical cord blood, and this kid was talking within 4 months, skipped grades in school, and told her mother, "I'm cool now." Cerebral palsy. Why it works on 20-year-old patients that have had cerebral palsy, I have no idea. It goes against our idea of what will work and what won't. Every cerebral palsy patient gets some benefit. And enough. Now, obviously, some of these patients are badly neurologically injured, but you can get them maybe to be able to feed themselves, whereas before they couldn't, and that will make a huge difference in their life and their caretaker's life. And we've done that. We've had hundreds of patients with that. Muscular dystrophy. In fact, my old partner just did something in Kansas that you should probably read in the paper in the next little while about how he's done about, I think at this point he's done about 5 patients with muscular dystrophy, and they all got better. All you do is inject the cells right into the muscle cells, and they get bigger, and the kid gets stronger. And the way you tell on a biopsy that you have multiple dystrophy is that there's no dystrophin. Can be found in them. Well, when you do the biopsy after the stem cell treatment, there's dystrophin in all the cells, okay? Spinal cord damage. We've had a number of patients that were quadriplegic come back. Even bowel and urinary incontinence was helped with this, and that's almost unheard of once you have cord transection.